Good afternoon and bonjour. Welcome to the closing news conference of the meeting of the Council of Atlantic Premiers. My name is Tina Thibault and I will be your moderator this afternoon. Nova Scotia Premier Tim Houston, Chair of the Council, will deliver some opening remarks. After that, we'll open up the floor to some questions from media. Go ahead, Premier Houston.
Thank you, Tina. Good afternoon, everyone. So I'm honored to be sitting here today hosting these fine colleagues from Atlantic Canada. We wrapped up our first in-person Council of Atlantic Premiers meeting. This was the first time the Council has met in person since 2019. There's new faces in the Council now since 2019. But before today, and still today, of course, I have to say I've been so appreciative of the kindness shown by the Premiers and their teams. They've been incredibly helpful in our transition, particularly in the first few months of government. And their teams have offered a lot of, they've been very generous with their time and guidance, and that has served us very well and helped us transition to government, but also bring us very close together. So I'm very appreciative of that. Thank you. We have a great team here in Atlantic Canada. After spending time with the group and getting to know their teams, Atlantic Canada, the Atlantic region, is well governed indeed. So we spent the last couple of days engaging in constructive discussions and relationship building amongst the provinces and our teams, and I think we're all very confident leaving here today that the special relationship between our Atlantic provinces has never been stronger. Throughout the pandemic, we saw that the collective collaborative spirit of our four provinces working together, it was really unparalleled anywhere else in Canada or the world, and the Atlantic bubble was kind of a well-known thing internationally, and it just speaks to how we can work together. So I think it's very fair to say that today we agreed to build on that foundation. We share unique landscapes, people, culture, but common goals, and we should always be working together to celebrate our uniqueness as a region, but to achieve our goals together. One of our biggest goals is to attract more people to our region with a collective approach to population growth, and I do want to thank the Federal Minister of Immigration, Refugees and Citizenship, my Member of Parliament, Sean Fraser. He joined us this morning. We had a great discussion with Minister Fraser, and I know he shares our vision for more people. We would be remiss not to have addressed the situation in Ukraine, and I want to thank Minister Fraser for the part that he's doing on behalf of the Government of Canada to help those in need, to help those refugees find a safe home, and we stand together with the federal government and with Minister Fraser with open arms to help those that are seeking refuge, and certainly here in Atlantic Canada. So with the situation in the Ukraine, it's shining the light on the need for more energy self-dependence, energy security, and certainly we know that there are many opportunities there as well. So thank you to Minister Fraser, and Minister LeBlanc was with us last night, and he's a great representative for Atlantic Canada. And we have, I think it's safe to say, we have a great relationship amongst ourselves, but certainly with the federal government. And thank you for specifically to Minister Fraser and Minister LeBlanc for participating over the last couple of days. So we had some great discussions. There's similar challenges, particularly when it comes to healthcare. It's safe to say that healthcare remains top of mind for each of our provinces and our populations. The shortage of healthcare workers, it's not exclusive to Atlantic Canada, certainly not exclusive to Nova Scotia. It's felt everywhere. We had some great discussions this morning about looking at the mobility of people, but mobility of healthcare workers, procurement opportunities where we can work together for more effective procurement, and also look at opportunities where we may have capacity in our healthcare systems where we can help each other. So those are all discussions that will continue, but I know that there'll be more to say on these during your questions, no doubt, but certainly with future cap. But I just want to thank these gentlemen again and say that on behalf of Nova Scotians and on behalf of Atlantic Canadians, I feel very confident that the relationship between your respective governments will suit each and every one of us well. So thank you for that. And now my colleagues and I are happy to take your questions. So thank you, Tina.
Premier Higgs, you didn't mention the Atlantic Loop in your remarks there. I'm just wondering if that did come up in the meetings between the four of you, but also with the two federal ministers. I'm wondering how much optimism the four of you have that this project will secure federal funding. Time is getting short.
Yeah, so thank you for that, Brian. And I was remiss if I didn't have that in my comments. We did talk about the loop both last night and this morning as well. And just in terms of the opportunities for more energy security for sure, but the greening of the grid. So what I would say is that those discussions continue to move forward. I do believe that the federal government understands the importance of protecting ratepayers in balance with the greening of the grid. So discussions will keep going forward, and of course there's lots of other parts to the energy equation that we talk about as well. But certainly the loop discussions continue to move forward. But I don't know if anyone else wants to. If we're good on that.
I think it was a very healthy discussion. Of course, from Newfoundland and Labrador's perspective, we continue to offer, I believe, to be the appropriate energy at this appropriate time in our history of transition, and we're very excited to be a part of ongoing discussions that exercise the full value of our resource, not just for Newfoundlanders and Labradorians, but indeed for Atlantic Canadians.
What about in terms of Mr. Higgs?
Yeah, I guess in talking about the loop and the timeline, so it is significant to look at over the next, let's say, 7 years. It'll be taking 7 or 8 years to have this up and functional, and maybe longer. And so there's lots of energy solutions that we talked about collectively in our respective regions and nationally in order to provide security for the long haul. And also looking at some of the current regulations and timelines that how they're going to mesh. So we've seen the concerns nationally, internationally of energy security, and I think it's brought a focus into, okay, what's real, what's achievable, and how do we manage this? And I think there's certainly a great collective discussion about there's so many options that we need to progress, but timing has to be clear, and because there are shortfalls out there that we got to manage. And we're fortunate to live in a region, in a country that is energy rich, and we can't lose sight of that.
Premier Higgs, if it does take longer than 7 or 8 years, that would put, I believe, your province in some jeopardy of not meeting a coal target, and certainly Nova Scotia is using more coal to generate electricity.
Absolutely, yes.
How would that position the two provinces?
Well, I think we're in the same situation, right? In terms of looking at the future and saying, okay, how do we realistically manage the timelines based on technology and advancement, and so we don't find ourselves at an end point all of a sudden and wonder what's next, but we build on what's real all the way along the way. I think there's a way to get there, but it might not be just as precise as hoped initially.
You talked about the mobility of health workers. Could you elaborate a little more? Like, what are you talking about in terms of moving health workers province to province?
Yeah, I think, thanks, John. So we all have incredible needs for healthcare workers, and to the extent that there's opportunities for them to maybe might have a surgeon in Newfoundland who might want to come do some surgeries.
I'm not going to be premium.
A surgeon in Newfoundland want to be premier of Nova Scotia? No, not gonna. But we might have a surgeon in Newfoundland who might want to spend some time in Nova Scotia and do some. Well, the licensing criteria, the fees around that. I mean, let's make sure it's really easy regionally for sure. But I think nationally. For healthcare professionals, I use the example of a surgeon, but there are many classifications, and people should be able to move around and help each other out. We are one region, and there's lots of family ties between them, and so those are the opportunities that I'm looking forward to. And Premier Furey did say he'd come over and do some surgery, so he might be backtracking from that now. But
where do the harmonization efforts stand? Because under your predecessor, there was a push on to get people's credentials in line in every province. In other words, to have them the same. and that kind of died on the vine, is my understanding. Is there any idea that you're going to resurrect what was previously?
It's not dead on the vine anymore, I wouldn't say. I mean, we've certainly agreed. I don't want to speak don't want to monopolize all the time, but I mean, I would say that with the next time the CAP meets, we'll move that a little further along, but there's a high degree of interest in harmonizing that stuff.
The end goal to get everybody on the same playing field in terms of.
I would think that one of the lessons learned from COVID, frankly, and when you saw different provinces reaching out for different areas of expertise when faced with different waves of the pandemic, that healthcare mobility is important. We all have similar training across the country, and if we can eliminate those barriers in the middle of an emergency, in the middle of an acute crisis like COVID, then that's certainly a lesson learned that we shouldn't forget. And moving forward, especially when it comes to the Atlantic region, and in fact, if not for the rest of the country. We're very fortunate, having worked around the world in healthcare, we're very fortunate here in Canada to have a robust licensing system that could be applied blanket statement to the whole country. We are very well trained in Canada. Once you're licensed in any jurisdiction, there's no reason to think that you shouldn't be able to practice medicine somewhere else.
So just to be clear, is it the end goal yet again to have one licensing system for Atlantic Canada at some point?
I think those are ongoing discussions. The exact model and instrument of which it remains to be seen, but there's an active live discussion.
Yeah, and whether it's just one entity, I mean, a shorter term goal may be that we recognize the criteria from other ones, so you don't have to go through the process again. But one entity, I think, would be the ultimate goal. But I think there's other ways to get there too.
Premier Houston, as you know, last night demonstrators demonstrated once again outside Robert Strang's home. You were pretty angry the first time it happened. I wondered, since your government brought in a law that built a bubble around hospitals, do we need to expand that bubbles to people like Robert Strang and other health officials who may be harassed in their homes?
I think so. I think it's I don't know that I have a strong enough word to really express my emotions over people protesting at the home of the chief medical officer. I mean, Dr. Strang, the service he's provided to Nova Scotia over the last 2 years, incredible service, a great personal sacrifice, a great sacrifice to his family, to protest at his home where he lives, but also his family lives, is completely inappropriate, and that's not something that should be happening in Nova Scotia or anywhere, quite frankly.
So would you look at extending that
We're
law?
looking at a number of options, what we can do to protect those serving the province, but it's inappropriate to protest at somebody's private residence. There's lots of places you can protest. Just don't do it at somebody's private residence. So we'll have those discussions, but for right now, Dr. Strang knows how I feel about it, and hopefully his family knows how sorry I am that happened to them.
Sure, I'd like to get back to the energy point of this. Churchill Falls, as you know, is part of the puzzle and the key to this.
Never heard of it. What, you said Churchill Falls?
Sorry, Muskrat Falls. Not a lot. And apparently there's a new report out on the software problems that says it's probably not likely it's going to be fixed by the end of May, which was the target. What did you tell your colleagues about the situation there and what to expect?
Yeah, I mean, the GE issue and the software issue is always a concern. The project itself has been a concern, as you know, as everyone knows, for quite some time. I'm not a software engineer. I put my faith in Ms. Williams, who's running Hydro right now, to liaise with GE, and they assure me that this is on track. I take the Liberty Report at face value, and it's certainly something that we always want to, as taxpayers, to have a critical lens applied to such a major project, especially one that has gone off the rails. But we're hopeful that this can be resolved, and anytime there's excess energy in Newfoundland and Labrador, whether it's through the developed projects, potential to add on to other projects or new projects. We're happy to be the battery, not just for Atlantic Canada, but we have such robust green energy supply that we think that we can be a quite healthy supplier to the rest of Atlantic Canada and even into the eastern seaboard.
Any discussion on eliminating the time change, and where do you all stand on that?
Yeah, there was some discussion on that for sure, and I think Dennis, do you want to take one? Or
I'm doing just wonderfully here, sitting back and listening to you be so eloquent and informative. But sure, look, it's something that we discussed and we've discussed before. There seems to be some movement in the United States to move the eastern seaboard, the eastern time zones, and to eliminate daylight savings time. And I think if that were to happen, we would have to react collectively here in some way, shape, or form. Essentially, we've all sort of decided that this doesn't make sense for one of us to do this. If we are to proceed with something, it would be try to do as much as we can on a regional basis in response to what might be done in other places. But you know, in my province, I think most people would be generally supportive of the elimination of daylight savings time, provided that it was done on a regional basis and in unison with other jurisdictions.
Sure, would that mean looking at the half-hour time change as well?
We like our half-hour difference. We like to be different, and we're going to maintain that.
We'll take a few more questions before we go to the phone lines.
So was there a discussion about the isthmus of Chignac to fix?
Yeah, there was. So we had a discussion last night with Minister LeBlanc. I guess what it would be fair to say is that we all understand the importance of this issue. It's going to be a significant cost, and there'll be many more discussions on how that cost is shared. But I think as a summary, and Blaine may agree, is that everybody's going to have to contribute financially to this. The federal government, and the government of New Brunswick, and the province of Nova Scotia. But it's early days in that discussion. Other than to recognize there's an issue there. That's
The threat there seems imminent, but there's a timeline of 10 years or so attached to it before this is actually fixed.
We're not at the stage of putting an end date as to when it can be fixed. But I would say that we've received the report. It's an ongoing topic of discussion. Certainly in our government and in Blaine's and now the federal government as well, for sure. So don't have any timelines to share with you. Don't really have any specific details to share. But other than to say that there's an issue there that will require a solution for sure.
Is it fair to say that at least you and Nova Scotia will have to agree on what it is? Is it a solution in terms of what you want to pay for when you get to that point?
Absolutely. I think the agreement that we are certainly very confident in. We want to keep connected with Nova Scotia. We think they should stay connected to the landmass here. So we're all on the same page there, and to the extent of what's required in order to mitigate the climate changes is yet to be determined. But there was a discussion and a recognition it's a project that has to go through.
Yeah, that's what I was driving at, because there's 3 options that were placed for the engineers, and they all had significant costs, right? So you're going to have to agree on what you think works and what you can afford, correct?
That's right. And that's why Minister LeBlanc's discussion last night was relevant, because this is obviously a big component to work with the federal government on.
We're heading into a construction season. There's no prospect of anything being done this year, is there?
Anything is a strong word, so who knows? But I wouldn't say the whole thing will be solved in this construction season. I think we're looking longer term than that. But are you going to fix it this?
No, I would doubt to see. We'll probably see many construction activities, but engineering, analysis, kind of where do you need to strike first, and how it's to be done will be shared. I would like to think over the coming months, year maybe, so that we kind of have an idea what is the right steps to take, and then where do you start and when, and so we lay it out over the next coming years. But probably won't see
one way to figure out the funding as well, doesn't it?
Correct, absolutely, yeah.
Houston, you're heading into a budget. It'll be your government's first standalone budget. What's your expectation in terms of transfers from Ottawa? Because over the past 2 years, all your provinces have received more money from Ottawa to kind of mitigate the damage caused by COVID and to try and deal with the particular challenges in healthcare. I just wondered, do you expect them not so much to turn off the tap, but certainly to lessen the flow, and how would you deal with that?
Yeah, here's what I would say is I think that the federal government was very helpful during the pandemic and should be applauded for that. I mean, certainly from Nova Scotia's perspective, when we've reached out, they've responded, and I think that's a very positive thing that I don't want to just let slip by. We will table a budget shortly in Nova Scotia. We will back in the legislature this Thursday, and the budget will come shortly thereafter. And what I would say is that during the campaign, I was pretty clear that Nova Scotia is facing deficits, some significant deficits for a couple of years, and I think our first budget will be consistent with that messaging. Just in terms of the support from the federal government, I don't really have. I'm not expecting any huge wide fluctuation in the short term. There are ongoing discussions around the next round of the health transfers, and those discussions continue. And I think the provinces want a lot, and the federal government maybe doesn't want a lot, but those are discussions, and actually Premier Furey is kind of representing Atlantic Canada at some of those discussions that are heating up.
You want to kick at the can, Mr. Furey?
Well, look, I'd echo Premier Houston's comments that certainly the federal government has shown in a substantive way that they were there during the pandemic. I do believe that there is a willingness to examine healthcare moving into the future. As a council, the Canadian premiers have put forward a position. Of course, the federal government has been analyzing that, but to be fair, we've been in the middle of a pandemic and with a lot of moving parts at a lot of different times. But now, as we emerge from that pandemic, I think it's incumbent on both sides, Fed and provinces, to come together to really put together a future-looking plan for the Canada Health Transfer. I think we've seen through the pandemic that the system that was in place had serious gaps in it, and it was chronically underfunded, and now is a generational opportunity to reset the needle when it comes to CHT.
We'll go to the phone lines now and take some questions from the phone. We'll start with Mary Kate O'Neill. Mary, do you have a question?
Actually, it's David Salter from NTV News, but her name is on the Zoom there for some reason. I just want to start with the Premier of Newfoundland, Andrew Furey. Premier, a lot of us expected a decision on permanent daylight time. Obviously, that didn't come today. When do you anticipate we'll discuss that again, and where we might go with it, and what Newfoundland's opinion is on it?
Yeah, certainly there was some discussion at the table, but I think it's wise that we reflect and wait for the United States, certainly the Eastern Seaboard, to make a decision. It would be, I think, irresponsible from a business perspective, certainly, and quite chaotic if we weren't aligned with the Eastern Seaboard in particular. So, we're going to watch and see what happens, and then evaluate based on what the decision is out of the elephant to the south.
Go ahead, David, if you have a follow-up question.
Yeah, what's the big takeaway for Newfoundland and Labrador, Premier Furey, from these meetings?
Well, I think there, to echo Premier Houston's comments, there is a great unity amongst us, especially when it comes to the energy file. I was quite pleased to receive the support of my colleagues with respect to Newfoundland and Labrador's position in the energy space right now, both on the renewable and the non-renewable side, as of course that we know that we have an abundance on both, and we can play an important role with respect to energy security in Atlantic Canada, and worldwide right now. So I was quite grateful to receive fulsome support from all three colleagues.
Next, we'll go to Adam Harass from the Telegraph-Journal. Go ahead, Adam.
Thank you.
Can't hear you, Adam.
Nova Scotia just brought forward a significant recruitment incentive plan. Premier Higgs, I just wanted to know, do you feel forced to match that in tomorrow's budget? And in terms of the other premiers, is there a way to I guess, potentially harmonize how you recruit?
I think that, the discussions we had today were very much in an Atlantic-based solution to healthcare. And as mentioned earlier, Premier Houston mentioned about the certification process and how we get aligned there, and discussions of making that happen. Innovation in healthcare is going to be a solution, not necessarily the ability to hire as many people as we need or want. So I think looking at synergies from one region to another, and where we can capitalize on maybe particular skill sets that exist. And, we can use the IWK as an example in that regard, but all of us can have those strengths in different aspects. And so how can we manage a healthcare system system that gives the best service to our citizens and do so within the guise of the demands that are on the healthcare system across the country. So I guess, Adam, to comment, we're not in competition. We very much say that. I feel a sense of camaraderie here. I would say that has only been enhanced by the experience we've all had with COVID and the Atlantic bubble. And the meeting atmosphere was great. And I feel like we're building on past cooperation and on future potential successes in real terms. And healthcare solutions and an innovative approach is what the focus is and the next steps in achieving that.
Go ahead, Adam, if you have a follow-up question.
Yes, please. The federal government to date has paid for rapid tests, vaccines, COVID vaccines, and a good amount of PPE. Is there concern that that support will run out and the provinces will be stuck with that price tag? And has that come up in any conversation?
Well, I was turning to our medical professional here and comment on that. Is that fair?
I mean, I think it's important to realize that the federal government has always been there for Canadians from coast to coast to coast when the demand was required. But as we move to an endemic phase of this of COVID-19, I think it will be it'll be important for us all within our own jurisdictions to look at mitigating issues and our own pandemic plans. I mean, I think we had a good conversation about how we can come together with the chief medical officers of health in our own jurisdictions after giving them some breathing time in the next few weeks to do a post-mortem and look at lessons learned and perhaps build on that towards a more robust regional approach to any future pandemics, which is an important lesson to be learned, I think.
Next, we'll go to Paige Woodard with the Times and Transcript. Go ahead, Paige.
Hi, yes. Just to jump back to a question about the possible time change. It seems that we're waiting on a decision in the U.S. right now, but I'm wondering, in your discussions, were any kind of firm timelines established? Like if we see that decision come in the U.S., will we see our clocks change here this fall, or is it more of a wait and see right now?
I think, thank you for the question, and I think what it is it would be, as has been stated, we have to really would be inappropriate for us to kind of try to front run some of the other jurisdictions. So I think it's really important that we look at other jurisdictions. I think that's in the best interest of all of our citizens, particularly the Eastern Seaboard for lots of reasons, but certainly I think waiting to see what actually happens there and then getting together and assessing that and coming up with a meaningful response that makes sense is the best approach. So no firm timeline from us, just other than that we recognize that it's what happens here. This is a situation that will certainly be influenced by what happens in another jurisdiction, so we wait for that to happen first.
Go ahead with your follow-up if you have one.
No follow-up, thank you.
Great. Next, we'll go to Pascal Rege, Radio-Canada. Go ahead, Pascal.
Oui, bonjour, vous m'entendez bien? Ma question, c'est pour le Premier ministre Higgs. J'aimerais savoir qu'est-ce qu'il y a comme possibilité de collaboration entre les provinces pour ce qui est des professionnels de la santé. Donc, qu'est-ce qui pourrait être des possibilités pour le Nouveau-Brunswick et pour les autres provinces? Par exemple, quand on parlait de chirurgiens, mais quelle autre possibilité est-ce qu'il y a?
Okay. So the question is for Minister Blaine Higgs. I just wanted to know regarding what we spoke about, the collaboration between provinces and the healthcare workers. So we want to know, the example was given of the surgeon, but we want to know what should we look for in terms of collaboration?
Well, I think the point that we were discussing is what other areas would be important to that. We know we got behind in COVID for, let's say, elective surgeries, and how can we best maximize those so people may say, look, I'm willing to drive a couple hours if I could get this surgery done now as opposed to wait for 2 years. What areas are like that? What areas can we really focus on that we've lost ground on during the COVID, I guess, period in hospitals. In terms of the actual healthcare workers themselves, you know, talking about the number of vacancies we all have in that regard, but it's okay. Can we share services? Can we develop a pattern of certification that, you know, we're sourcing people from let's say a similar location, but we know the certification process. We had great discussions with the immigration minister this morning about how do we consolidate our, let's say, what are the requirements are to work in one province over another, and can we make as many similarities as possible to make it easier? Can we look at trades and basically say, you know, these are the type of trades we need, and here's where we can source them, and so we're looking at simplifying the process to expedite the process, and I guess I was excited about the level of discussions. We have a lot to offer in every province, and we all can be strategic in our own way, from sharing ideas to sharing services, and that was kind of the nature of it.
Go ahead, Pascal, if you have a follow-up question.
Oui, ma question est aussi pour le Premier ministre Higgs. Pouvez-vous m'expliquer un peu qu'est-ce que vous voyez comme avantage à éliminer les changements d'heure, donc le Daylight Savings Time? Qu'est-ce qui serait l'avantage de ne plus changer l'heure 2 fois par année?
Okay, so the question is also for Minister Blaine Higgs. I would like for you to let us know what advantage do you see in eliminating daylight saving times?
Well, it's interesting. I guess we may have all different, I get lots of people to comment about it, particularly in the fall and the spring. I guess we wouldn't fall back this fall if it happened this summer, but that's probably unlikely. There seems to be an interest throughout the province to have some stability there of an inconvenience, more or less, that happens once a year. But I think the jury's still out, and what would be the main kind of concerns or direction that the public would want us to follow. So it's not a push. I mean, I don't think it's anything that we're pursuing in an expedited manner in any way, but I do think it's very relevant, as was stated here earlier. If we see movement in the U.S., we see changes in Ontario and Quebec, then certainly that would have an impact on what we need to look at as an Atlantic region.
Next, we'll go to Janet Whitman from Advocate Media. Go ahead, Janet. Janet, are you there?
Yeah, sorry, I'm here. Just regarding energy security and the Atlantic Loop, I think the main source of supply, the expectation would be that it would come from Quebec, but I think we'd be competing for that power with New England and New York. So just wondering how secure supply it is.
More secure with Newfoundland and Labrador's power attached to it, that's for sure. So, I mean, you're right, it would flow through Quebec as a part of the backbone, but and if we're continuing with an anatomical analogy, there is no backbone without a brain, and Newfoundland and Labrador will certainly be the supply. No question, Hydro-Quebec has a large supply, but Newfoundland and Labrador's component of that is quite large and is firm, so there is incredible opportunity to continue to work to be the more robust supply.
Yeah, and thank you for that, Premier Furey, and also other alternative sources for energy. I mean, I personally am very excited and interested in the production of green hydrogen. There's, you know, some talk about evolving technologies around nuclear, where you can reuse spent fuel. There's just, the world is changing very quickly, and I think there are incredible opportunities. So when you look at the energy mix, which really speaks to energy security, you're talking about a whole mix of different generations coming onto the grid, including hydro.
Go ahead, Janet, if you have a follow-up question.
Great, thank you. What about putting more emphasis on homegrown solutions so we're not so dependent on imports? And I'm thinking potentially biomass and also geothermal.
Yeah, I mean, look, it's I would put solar, put wind. Certainly here in Nova Scotia, solar has been a topic of discussion in the last little while. I'm anxious to make sure that solar is an opportunity at the household level. But absolutely, I mean, these are important discussions, and we consider all sources of energy in the main grid formulation.
If I was just to add to that a little bit, the recent crisis in Europe has brought, I think, a renewed concern about security in North America and with our allies. And so I think that as Premier Houston has laid out, there are a lot of options on the table for us as we get greener and cleaner. And timing, as we talked earlier, is important as we transition. But we have found ourselves vulnerable, not only as a nation, but vulnerable as our allies in NATO, to third world supplies that are not stable and that are very much jeopardizing our way of life in many ways. So I think it's important to say, we had a plan, ideologically it was in place, but the events of recent months have put that plan in we need to rethink how we continue to manage our resources in our country and how we stabilize our ability to be secure in North America and beyond.
We have time for one more question. We'll take that question from Juanita Mercer from the Telegram. Go ahead, Juanita.
Thank you. My question is for Premier Furey. Premier, almost a year ago now, you asked 3 of your ministers in their mandate letters to collaborate to advance the Natural Areas System Plan. How is that work going?
My understanding is it has started. I'd be more than happy to give you a more fulsome update after I have been debriefed by them, but in my understanding, the work has begun.
Go ahead, Juanita, if you have a follow-up question.
Great, thanks. I guess this idea of a Natural Areas System Plan has been ongoing for at least a couple of decades now. Any indication of a timeline for that?
As I suggested before, I'm more than happy to provide you with an update after I get to be debriefed by the relevant ministers.
And we'll take one last question. Go ahead, Jean.
Can I just follow up with you, Premier Higgs? You mentioned one of the things you might be looking at is with the waiting list for surgeries. Are you talking about people from Nova Scotia having surgeries in Moncton, let's say, or vice versa, or what are you talking about?
Yes, it was that level of discussion of where do we have, and do any of us have excess capability? But if we have excess capability and we can utilize that, then let's not get hung up on where it is. Basically, that we could provide it collectively, and obviously the respective province would pay for an individual would come to another province. And so I just think that was the concept, and I think the discussion is thinking beyond our borders in ability to provide the healthcare services that everywhere are being challenged.
Any of your provinces have excess capacity right now? No, I can't imagine.
Well, I don't know. We don't know. But we're going to look at all the different specialties. And I think I would say this. If we identify that there is excess capacity in one province, we want to try to find a way to make that capacity available to those even that may be resident in another province. But this is a topic that was brought to the meetings today, and I think it was unanimously agreed that if there is capacity that can be put to use to benefit citizens, it should be, and it shouldn't be limited by provincial borders.
That's all the time we have for questions. Thank you very much.
Did you have a question? Did you want?
Well, I was just wondering, how soon we could be seeing this kind of mobility within the provinces, or even this one licensing system that we've been talking about today. How soon is that something we could actually see?
Well, look, and people would know that my entire reason for being right now is to improve the state of healthcare in Nova Scotia. So every one of these things is urgent, but there's always a lot of details, and so we're going to work through them. I think there's a commitment from us with a sense of urgency to look for opportunities. So I would say the sooner the better is the short answer, but how soon that is, it's hard to say.
If I could just add to that, because I represent a province that's very small, and we currently utilize many services in Nova Scotia and New Brunswick, for example, in areas of specificity that we will never be able to do in PEI. So the conversation that we're having is really a larger conversation to try to to determine what we have as a region, what is our capacity as a region, how we can work together and find the synergies in this. We all realize that, to Jean's question, that there's not an excess capacity in every province right now, a whole lot of openings here or there, but how do we, when we look forward as a region, how do we find some synergies and find some capacity in the regions with one jurisdiction doing something a little better than the other, or one focusing on the other so the other doesn't have to? It's a much broader conversation than just can you fly to St. John's and get a hip surgery from Canada's second most popular premier. I mean, it's but you know, but in reality, it's our responsibility, having gone through COVID, having worked together so closely through COVID, finding some synergies within it. How can we? What are the potentials to expand upon that? And it's you know, we know there's no simple solution here. We're not going to start this tomorrow, and we haven't held ourselves to that time frame. But the responsibility we have to our citizens, to the patients that we're trying to serve each and every day, how can we best utilize all the resources we have and find those efficiencies? So that's really the, from my perspective, how we've really viewed this whole conversation.
Thank you, Tim. I just wanted to, one of the other topics that certainly is very concerning with us is the rate of inflation, and we're all experiencing that throughout our collective provinces. And the idea right now of a national rail strike is very, very concerning. And so we this was a topic last night, speaking with Minister LeBlanc and the Minister today as well. And I guess we just urge the federal government to take quick action to deal with this, because we have enough compounding issues that are causing everybody's home commodities to be more and more and more expensive. And a national rail strike will only add that fuel to that fire significantly, if necessary.
Thank you. That's all the time we have.
Thanks,
Premiers.
everyone.
Thank you very much.